Nova Scotia currently have routes for eligible international medical graduates, that's physicians, to practice medicine in Canada. And I'm going to take this step by step for avoidance of doubt. If this video is too long, you will get a part 2 of it. But I want to break it down in a way that anybody that is listening to this video will understand it. And that brings me to say, if you're coming across my channel for the first time, please subscribe and put on your notification button so that every time I make a post, you will get the notification. Not only that, that's an opportunity for you to encourage me, because this is not like an entertainment videos that I can just come and do anything. It takes me time of hard work. So just to encourage me, share this channel with your friends, share this video with your friends. Some of you have WhatsApp groups where you can share it, Telegram groups where you can share it, that you have many doctors. Please do this to support me growing, and that's the way you also can be supported, because I know if you want to succeed, you should also pray for others to succeed. So what do I mean? Please subscribe, share, like, and invite your friends. And that takes me to what I have for today. For international medical graduates who trained outside of Canada and want to work in Canada, come close. This is for you. I'll break it down in a way you will understand. If we don't finish it in the first 10 minutes, I will make a part 2 of it. So keep your fingers crossed. The main route for this Nova Scotia program is called the Practice Ready Assessment Pathway, and it goes through what? PACE. And what's the meaning of PACE? Because you're going to be hearing PACE all through this my video. Is Physicians Assessment Center of Excellence, where you are being assessed to come and practice medicine in Canada. So the first step is about 14 steps, so I'm going to take it one step at a time. The first step is this: check that your medical school is recognized. Your medical degree must be from a school listed in the World Directory of Medical Schools with appropriate Canadian sponsor notes. So you have to verify and be sure that your medical school is what? In the World Directory of Medical Schools. I've had somebody reach out to me from Democratic Republic of Congo saying that he couldn't find his own medical school in the World Directory of Medical Schools. So you need to actually verify, especially for new medical schools across the globe, because this is not centered to any major country. It could be you watching this. So check what is obtainable in your country. That's the first step. Then the second step is make sure you have enough postgraduate or internship training and independent practice. This number 2 is divided into A or B requirement. So it's either you have the A requirement or you have the B requirement. Now, this is the A requirement. A requirement is you must have the 24 months of internship / postgraduate training. For those in Nigeria, this is the example of your internship / postgraduate training. Your internship of 1 year and your 1 year of NYSC. That's the 24 months of internship / postgraduate training. Then the second one is this first criteria have this 24 months plus 12 months of independent, unsupervised, licensed general practice. Underline the word independent, then unsupervised. You know, as NYSC, you have some level of supervision, but a house job is full supervision. But here, after you have gotten your NYSC internship, which is what I call house job, then you now have a 1 year unsupervised practice. And this is where you have medical officers manning healthcare centers, medical officers manning private hospitals that are accredited, and medical officers working in different places. So as a medical officer, which is what other countries call general practitioner, you do what? You have this 1 year. Because I get to see my medical officers from Nigeria wondering if they are qualified. Please, if you have this criteria, you met this criteria, I will advise you to give luck a chance by applying to Nova Scotia. You know why? You can apply from your home country, whether you have your permanent residency or not. The reason is this: if you qualify, they can now sponsor you to come. And many people in Nigeria have done it. If you listen to your friends, you will hear it. And that brings me to the second aspect of this number 2, which is 12 months of internship or postgraduate training plus 24 months of independent unsupervised practice. This 12 months is this. For those of us in Nigeria, there is an age you will graduate, you will not do NYSC. So your 12 months of internship now is captured. Then 24 months of independent unsupervised practice. So you didn't do NYSC. So you finished house job, you start working. So that 24 months have now qualified you for this route. 12 months internship, 24 months postgraduate training. Whether you are working as a general practitioner or you're working as a family physician, you're 2 years in the residency program, this route is for you. Whether you're a medical officer practicing in a health center or anywhere, this opportunity is for you, and I advise you to leverage it. So that's why I'm taking time to explain it, especially for those of us in Nigeria, that I understand your system very well, because that's where I trained myself. Then that brings me to saying this for this number 2. This number 2 have the A and B that I've explained. The A, 24 months plus 12 months of unsupervised practice. The B part of it is either you have the 12 months plus 24 months of unsupervised practice. So whether you did NYSC, you didn't do NYSC, there is an opportunity for you. That's the criteria 2. And in this criteria 2, it is important for physicians in Nigeria, which is where I'm very conversant with. So if you're watching this, because I also have like 70% of the people following me here are Indians from other countries and as well, I think Kenya and all that. I want you to also liken it to what is obtainable in your country. The thing is this, is important for physicians in Nigeria because internship plus subsequent independent general practice may potentially satisfy this structure, depending on how the college evaluates you and what you presented. That's one. And that takes me to number 3 step, which is what? Check your rotations. For the office-based primary care pathway, you understand what is primary care as a medical practitioner. You know this. So you need what? These are the rotations. If you don't have, you can start now to start doing it. 8 weeks family medicine or general practice rotations. 4 weeks surgery. 4 weeks internal medicine. 4 weeks pediatrics. 4 weeks obstetrics and gynecology, 4 weeks psychiatry. I know people have challenges with psychiatry very well, but this is what you can actually take 1 month off. Just 4 weeks, 1 month leave from your work and go and get this rotation, because every rotation you are presented should be verified or verifiable. So note, Nova Scotia has some flexibility with this. And that's the beautiful thing about it. The flexibility they have is that if you missed psychiatry rotation and where you are working, probably you're working in a psychiatric hospital where you see psychiatric patients in your unsupervised practice. Now, if you're able to make provision and evidence to say you are seeing patients in psychiatry, this rotation can be waived. And they can waive rotations up to 3 rotations. So it means if you met others and missed probably O&G, psychiatry, but in your practice, you are able to say, okay, I worked in this department. Like me now, when I was in Nigeria, I worked in a specialist hospital, rotated internal medicine, O&G, and pediatrics. So if I didn't do a rotation in my house job and present these ones, and because they are able to be verified when you go to that facility, it is easy for them to say, okay, we're going to waive these rotations you didn't do for you. I hope this is very clear to someone listening to me. And that's the beautiful thing about it. And also for registrars that started residency in family medicine, if you're finished 1 year or you're in your 2nd year and you've done these rotations and you've done psychiatry, that can also count for you. So, but remember, all these things have to be what? Provable. So you have to prove that these things, you obtained it and you have it. This video is already getting to 10 minutes, so you are going to what? Get the part 2 of it, and stay tuned because the part 2 is following suit immediately.